It's my pleasure to introduce James Hunt, President and CEO of the Massachusetts League of Community Health Centers, which is, as Deb said, one of the founders of the Neighborhood Health Plan. In his more than 35 years with the League, Jim has helped to raise the visibility of health centers, both our strengths and challenges. He is continually working to bring us the resources we need to serve our patients to the best of our abilities. Under Jim's leadership, the League has gained the national recognition as a model primary care organization. Jim Hunt.
Thanks, Bob. Hi, everybody. Isn't it great to get some good news once in a while? It's really important to once in a while sit back and understand that what this is all about. It's all about the stories of community health, and I'm going to hopefully tell you just a couple today. The first one is just a snapshot of Lawrence in 1983, the fledgling health center in downtown, in financial distress. The League itself was in financial distress, but was called by the mayor of the city of Lawrence to ask us to intervene. And we convinced the mayor and the Department of Public Health at the time to allow us to, A, keep the health center open and to build it to serve 8,000 patient visits. So it's heartening that I guess that's been, I don't even want to use the exponential number, but 220,000 patient visits is a long way from 1983 and becomes the central point of community health here in this, this great city. So thanks, Bob, to you and your team, and thank you to all my colleague health centers who have joined us today. And hopefully we'll be able to capture this moment in a photo opportunity after the speaking program. But I also want to acknowledge our chair, Tony McGuire, who has arrived. Many colleagues make a whole, and today the 49 community health centers together serve over 800,000 patients in the Commonwealth, many of whom have a great and connected affiliation to NHP. As I've always said, when you've seen one community health center, you've seen one community health center, and this is a health center that in fact has gone in a direction of identifying need, meeting that need, and also training our providers in a multicultural way for the future of healthcare, both here and, as Bob said, internationally. 47 years ago, the first community health center was established, and its goal was to serve patients one at a time, not only through the delivery of medical care, but working to address the factors that create and perpetuate poverty. Health centers are filled with stories that illustrate what truly comprehensive health care can do to an individual. It is this kind of care that Greater Lawrence Family Health Centers delivers here and our other 48 deliver every day. Whether it's providing transportation or daycare, educating patients on the best practices for their children, helping a family better manage their finances to improve their financial health and mental well-being, or, as we've seen in the last couple of weeks, responding to emergent public health emergencies such as the flu epidemic. And I thank Cheryl Bartlett and her team at the Department of Public Health for the great amount of partnership and recognition of the role community health centers do and can play in these communities. So this is a short list, and there are many more ways that health centers make a difference in the life of individuals and the life of communities. Let me just tell you one of those stories. When Sharon was 16 and found herself pregnant, she turned to the community health center she had grown up in to help her with her mother and her sisters. She found that the staff was concerned not only for her baby's health, but also for her future. From prenatal and pediatric care to the center's food pantry and daycare services, she found encouragement, support, and help that allowed her to focus on matters beyond subsistence. Sharon has said that being able to walk into the health center and know that the doctors and nurses would keep her family healthy let her focus on other things like creating a life for herself and her family. While her baby was at the center's daycare, Sharon completed her GED with a secretarial certificate and got her first job at that community health center. What followed was several years of working and attending classes, and she eventually achieved a Bachelor of Arts degree and discovered a better life. In fact, Sharon returned to school yet again to complete 2 additional graduate-level certificates, and in 2004 became a paralegal. She was working in legal services at the time and became head of the team, educating patients, particularly vulnerable ones, in the language of their own around the influences of Medicare Part D and what it could do for people. It reminds me of Dr. Jack Geiger, the founder of the health center movement and the first health center in Boston, and what he envisioned in Boston and rural Mound Bayou, Mississippi. He understood that education and economics and social opportunity were all at the heart of the individual in their community. And in order to fully realize the potential of communities and those individuals, we had to recognize all of those things. Many of us in this room spend our days talking about global payments, risk sharing, health information exchanges, and care coordination. And don't get me wrong, that's all important. But as the champions of change, it is our responsibility to remember that the original vision and work together to meet reform's most important goal, improving and sustaining the health and well-being of every Massachusetts community, one patient at a time, is at the heart of the Community Health Center success in our program. Thanks to this generosity of Neighborhood Health Plan, the partnership of Community Health, the great leadership of Partners Healthcare here in Massachusetts, showing example for not only this state but for the nation, we can not only reflect on this success today, but understand that these real investments will make a difference going forward in Sharon's life and all those we touch. Thank you very much, Bob, and thank you all.